Hi, Dr. Joshita. We can start the
Hello, good
presentation
morning.
now.
Hello, good morning, everybody. My name is Joshita Poojary, and I'm a physical therapist and have my master's degrees in orthopedics and sports. So I have been practicing in the field of physiotherapy for almost 5 to 6 years. It's been a long career, and I'm here to give you a lot of tips and tricks today to how to make your work more efficient and make you feel better even at work so that you are not stressed. You can increase your productivity. You can work better and you don't feel that fatigued and tired. So you can also include your other activities that you wish to do apart from your job. Because I have always heard, feedbacks where clients are unable to, do what their passion is because they're extremely fatigued. They're very tired. So I'll try to give you all more tips and tricks that you all can incorporate in your everyday life. Okay, can we begin? So I want you all to understand what is ergonomics, what exactly ergonomics means. So ergonomics is nothing but a work environment that gives you a lot of comfort and is not hazardous to you at any cost, where you are straining your muscles, your joint, or your body to work. It has to be an environment where you do not get any kind of injury, no matter if it is a chronic injury or injury caused due to lifting heavy objects, or improper posture, or your working hours are too long and there is no awareness of how you need to take breaks, so that you can give yourself rest in between the work. So ergonomics is not only designing the workplace better but also making yourself effective to perform in your workplace. Okay, so I always tell my clients that it's not always about the environment, it's also about yourself, how you are keeping yourself active, how you're keeping yourself energetic, because all of this together is going to make a difference. Sometimes you might not have an environment which is very ergonomic friendly and still you have to work there. So how you're going to adapt yourself to these places are one of the important questions that had been raised during the COVID times when we were at home and we had to do work from home. And I'm sure many people are still practicing that. So when you are at home, how is the environment going to be very effective and friendly for you to work and give the same amount of results? So if you are able to do a few tips and tricks that you incorporate in your everyday life on everyday basis, that will make sure that whether your designated areas change, you will still be able to perform better. You'll still not have those pains, aches, and you'll still be able to, sit comfortably and work and deliver your work at the same. You wouldn't basically miss your workplace, which is why taking breaks, prioritizing your work, which work needs more time. You know that a particular work requires more time, so you prepare your body for the same so that you do not have to get fatigued over a period of 2 to 3 hours. Okay, so So here is a very interesting image that I've kept just to brainstorm everyone. Just look at this image and keep thinking what comes to your mind first. When you see a man pushing this trolley, I will definitely explain you what exactly it means. And I want you all also to, brainstorm yourself to understand what exactly this image is trying to tell you. Okay, so we see there is a man here pushing his trolley really hard. He's very angry. You see a man stooping his posture and trying to rush through a market, maybe. Okay, so what I want to explain through this image is that now the basket is really empty. Okay, as he's going to shop more, the basket is going to be full and he's going to have more and more things added to his basket. Can he just push the trolley with the same similar one hand and with this posture? It's definite that he's going to you see there is imbalance in his posture. You see that there is a lot of anger and aggression that he's come with to shop weirdly. Okay. So, of course, so what I want to tell you, at your workplace, you're also going to have similar issues where you're going to be put onto a lot of work, piling of work. There'll be a lot of work that you need to do. At the same time, you're using the same technique that you were using earlier to do the same task. Maybe a single task won't cause so much effect on your neck, on your lumbar, on your body. But when the tasks keep getting added, of course, you have to change your technique. You have to make it more balanced. He needs to use both his arms. He cannot put all his load on his neck. He needs to maintain a better posture. And he needs to use both his hands and use the body weight to push the trolley when the things are added. If he fails to do that, there is, of course, going to be some imbalance. There's going to be as you see, the wheels are moving. Similarly, our body mechanics will also move because our body weight will shift, and we don't know whether we are constantly against the gravity or we are within the gravity, we are maintaining a good posture. No. And after some days, maybe you're constantly doing it for over a longer period, just like this trolley, maybe the wheels might break and he'll be, not able to push, and it will be not functional anymore. So similarly, whenever the weights are being added, we have to use our body mechanics to support ourselves in such ways that as the stress or as the load is being added on us, we should not be afraid that we cannot manage it. Because if physics is added to this, if this man takes all the load in a basket, uses his hand power, uses his right mechanics, even then he'll be able to push this trolley very easily. Okay. So this is just for brainstorming, just to understand how our daily objects that are around us, where we are using physics to it. Similarly, we have to use physics for our own body, which is the most important part of our life. Okay. So, what are the common postural problems for a desk worker? I think most of us, all of us would know about it, that one suffers from neck pain, one suffers from extreme headache, slouching of posture, forward neck posture, rounded shoulders. People, tend to develop shoulder pain and often say that, oh, we don't know how this shoulder pain really started. But there is a reason why the shoulder pain started. There are many problems that arise due to prolonged sitting. If you know this, this line that has been given by WHO, that sitting is the new smoking. People sitting for 8 hours, 9 hours, have been developing chronic discal issues and herniated disc at a very young age. Is because the prolonged sitting is really not good for us. Our body is meant to move. We cannot be sitting for hours together, like 8 hours, 9 hours, without taking breaks, because the body is really not, functionally not prepared for it. It's not made for it. It's not developed for it. And the awareness of this issue is the first step towards implementing effective solutions. Of course, if one addresses that one is suffering from neck pain, one is suffering from shoulder pain, or one is suffering from wrist pain, elbow pain, or back pain, at a very early stage, if you are able to analyze, okay, I'm having this certain problem, you will be able to come to the cause of it very early. You do not have to wait for something really major to happen, and then you undergo x-ray, undergo MRI, and then you see that, okay, there are so many changes that has happened and now it's too late. No, it's not like that. Some findings are accidental. So in today's world of chat GPT and Google, we are always on to putting, okay, I'm having this neck pain, I'm having tingling sensation, numb, fingers are going numb. As soon as I get up from the bed, I'm having extreme tingling sensations in my arm. My arm is feeling weak. If you put these symptoms, the first thing chat GPT or Google is going to say is that your disc has been compressed and you're having some nerve issues. And if you don't undergo a surgery, it might get really bad for you. So it's not always like that. Understand the symptoms and always seek help. Always, first thing you need to go, you have to go to a doctor, you have to go to a physiotherapist and maybe ask them to diagnose it for you. Because why I'm saying this is, when you Google your symptoms and when you come across herniated disc and these kind of issues, the first thing is your cortisol level goes up. which will indirectly affect your workplace. You're always thinking that, okay, I'm having some serious problem. I will not be able to work. I'll not be able to support my family. And there are X reasons that will increase your cortisol level every single day. These cortisols are really not good, which is the main reason one is also suffering from diabetes, because insulin needs to metabolize in the body. And cortisol, you all would have heard of this hormone. It is released when one is really stressed. Okay, that doesn't mean you cannot get stressed. Of course, you can get stressed, it's normal. Okay, but when you are overstressed, prolonged overthinking happens, and because of which your cortisol in the body is not able to let the insulin function, and maybe you were never having diabetes. And then the report shows, oh, you are at a borderline diabetes. Okay, I don't want to go that far, but I'll come back to where I began. Now, the first step, when you experience the back pain first, or when you experience the neck pain first, why is it happening? Understand that. So, when your body is in a static motion, when it's sitting or it is standing for a long period of time, the body cannot take, like, it needs to move to function. So I always make people do this activity, to hold the bottle in their hand like this. Can you sit and hold the bottle in your hand the whole day? It's not possible. It's not possible. Your arm is going to hurt after a certain period of time. Why? The ligaments, the labrum, the muscles, they all kind of get fatigued because they are not meant to. They need to move. The more you move, the more you move your muscles, they are not at fatigue. They will always respond to you. So when you know that, okay, when I'm sitting constantly and working on a platform continuously with my forward neck, and I'm doing this continuously, okay, because I have some deadlines to meet, and I'm just doing this. The minute you touch a period of 2 hours, 1.5 hours, that's it. The minute you extend your body, everything starts hurting. And the day you go back home and you sleep and you wake up, next day you come with a spasm neck. And why did this happen? Because your body, again, your muscles and your ligaments, they need enough water, they need enough blood supply, they need enough oxygen in order to function in their maximum capacity. Any body, any part of your body, you take it your mind, you take it your heart, you take it your lungs, kidney, muscles, bone, all of this require this function. How will it happen? If you need a water to flow, you need to push the water. If you need to push the water, you need your muscles and the body to pump the water. If you do a slight movement even while you're working, when you know that you're sitting and working, and you just straighten up your neck, you straighten up your back, and then just correct your posture, or you just do this while you're sitting, okay, and you just move your legs up and down, and you just rotate your spine for just 2-3 minutes. In the span of 2-3 hours, I'm sure you won't get as fatigued as you would in case where you're sitting constantly and absolutely not moving. So you gave your body a little bit of movement, little bit of function, the blood circulation is happening. A static portion can stop the blood circulation. And then when you suddenly get up and try to do, by then it's when your muscles are already in a fatigue stage. And the next stage to it is spasm, sudden spasm. You'll do any activity, you'll end up in spasm. So these are the common postural problems in desk where it can go up to. I've started from a mild muscle ache to the areas where it can be very serious issues for you. So when you address it first, focus why is it happening, and try to make some movement, try to make some daily life changes so that you don't, have these problems on everyday basis. Okay, so this is how you look after 3 hours. So of course you don't want your neck to have that hump, and you don't want you to look like this when you're turning 50. I'm sure everybody wants to look handsome and beautiful. So try to take care of yourself now so that when you reach 50, you can start fresh. You won't feel like, oh, I have 50 years of work life and now I cannot do anything. I'm sure you can do so much more. Okay. So this is a concept that I want to explain to you in deep what really happens when you're sitting for a longer period of time, and your neck has been pushed forward like this. So do you know that we fail to understand that when that we live on gravity? So gravity is constantly acting upon us. That's the reason we are able to walk and we are not flying like astronauts. Okay, Since we are not flying, we are not making any effort to be in position. So gravity is constantly keeping us in position. When you keep your hand or arms or any part of the body on gravity, you kind of get fatigued. Okay, because there is some kind of force that is constantly pulling you down. So you see this neck, how it has been placed. Like the neck muscles are being pulled downwards, and your body is trying to adjust it by pulling it backwards. There is constantly opposite force acting on your neck. When there is a constant opposite force acting on your neck, which means the muscles are doing lot of work to keep your joint and the disc and all the other organs in place. So when they're doing that job, of course, they're going to get fatigued. So imagine your neck being constantly pulled to the gravity like this. When you do this movement, if you want to try, you can do this movement. You see, there'll be crowding of the spine just below the skull area. And that will cause the compression of the disc, which will further lead to compression of the nerve. And that compression of the nerve will further lead to weakness of the arm because the origin of all the nerves are from these areas. That's the reason this is not good. And imagine if it is for 2 hours, 3 hours on constant basis every single day. The experience on your CV looks amazing, but the same experience that you have given to your body doesn't look good when you turn older. Okay. So when you're aging, that experience, that 5 years, 6 years, 10 years, I have worked in this company, just think how have you worked? Were you ergonomically doing well to your body or giving that space to move around and giving the muscles enough of things? No, it's just the number that you're contributing, but that number can lead you backwards. You have to think that 15 years that you've given to your company, you have also supposed to simultaneously be able to give yourself as well. So you need to think for yourself as well. When you're sitting and working, every minute, every second, every hour is going to make a difference. Okay, so these words that I've mentioned here, sternocleidomastoid, scapula protracting, these are just scientific terminologies, but they are trying to say that your posture, how it has been affected. So this is one of the most important thing that I want to show you guys. When you're sitting for long hours, this is how you turn out to be. Okay. So when you're moving, you see the muscles are moving so beautifully. They are making that action. So any movement that you make, you might just feel that, oh, my joint is moving, nothing great is happening. No, the muscles are really contracting. How will you move otherwise? So even the mild of contraction that you give to your body is going to give you returns. Okay. So this is your core muscle, which you're sitting on the whole day. If you're not able to move your spine, one day you go visit the doctor and say you're suffering from back pain, and the doctor says that stop moving your spine, stop bending, stop extending. Do you think you can work like that? No. These are the most important things for your body to function very well for you. Okay. Now, why these things happen? These things happen because there is repetitive movement at work. Like you are constantly sitting and typing, constantly doing the typing work, constantly doing a repetitive work of, protracting your shoulders, protracting your neck, and the duration and effort really matters. So if the workstation is providing you everything like a desktop, a keyboard, a chair, and everything in place, then you should be able to use it for your maximum benefit. You should always make sure that your desk is at your eye level. You are not overusing your fingers. If you need to type something, stretch your hands a bit and then go ahead typing, because your repetitive movements, awkward postures, and force that is acting on your body is where you cause the major problem to your body. Okay. And there are different kind of conditions that one come with us, with strains, pain, sprains, tendinitis, low back pain. I've already discussed all of this, right? Rotator cuff tear, spinal disc. How does rotator cuff tear happen? By sitting, if you're not even moving. So what happens really is because you are constantly protracted and this position is not really good for shoulder. The minute you're in this position, you have already caused inflammation to your tendons of your shoulder. So whenever you will move next, it's obvious that you might end up in a tear because tendon is no longer taking your load because you've already loaded it way too much. Okay. So again, sciatica, people get really scared of. It happens when your muscles are over contracted. They're sitting on it whole day and it kind of compresses the nerve, and the symptom starts running to your leg. Maybe if you would have stretched it, it wouldn't have happened. So movement is the most important point of having ergonomics in place. Okay. So these are the setup. This is the prolonged repetitive movements you do when your wrist, when you're moving the mouse, there is incorrect angles that you produce when you're moving, and this is how you kind of when you're tired, you kind of take this posture. It's not that this posture is poor, but if it is being used throughout the day, yes, it's going to be harmful for you. Okay. Now, this is how you are supposed to sit. But as humans, it's not really possible to sit straight like a robot all day. Is it possible? No. Can you stand all day like this, very straight, very right posture? No, you cannot. So, this is the ideal angles that one needs to maintain while they are working. However, when they are sitting even like this, they need to make desired movements of their back, of their neck, of their wrist and elbow in order to keep your body functional and not be suffering from low back pain or neck pain. So if you think that if you're sitting in this 90-degree angle with this right angle on your legs and you're not going to have a back pain, no, you will have back pain. But if you add movement during this thing when with your tea breaks and with your washroom breaks and everything, then probably you will do a better job for your body. So drinking water is more important. Of course, coffee is needed, but yeah, you need to drink a lot of water so that you can use the washroom. While you go to the washroom, you can do some stretches, move your calf, move your body, and it will help you long way. Okay. Now, just to make this class a bit fun, I have come up with a quick analogy based on what you guys incorporate in your daily life. So posture. For me, posture is just like a personal app optimization. See, it's like based on how you're feeling, if you sit, if you optimize yourself, you're going to give yourself a better posture. If you're just going to be in one position and not optimize it, I'm sure it's your like a phone or like a computer that goes into hanging mode. Your body will also start in the hanging mode. Okay. So we have muscles in the body. We should either use it or lose it. It's like investments. As I told you, if you so many muscles are there already produced in your body. If you make even use of one muscles each day, I'm sure it's going to be your best investment that you have given yourself when you turn 50 or 60. Okay. Sitting is a subscription app you forgot to cancel. Isn't it true? Because you sit and then you forget it's 5 o'clock and it's time to leave. And you didn't even get up, like you must have got up like two times. That's it. One for lunch break and one for tea break. Is that enough? No. Make as much movement as possible. Okay. Keyboard warriors. It's today's digital athletes. They, as soon as they know that they have to punch out, they are going to do everything to finish their work on time. But do you think it's going to help? You might, long run develop arthritis. You might have inflammation in your fingers because you have pushed your fingers so hard, and then all the fluid and all the repetitive movements is going to cause inflammation to your tendon. So avoid being a warrior. It's okay. Sometimes it's okay to be late. Just slow down your work. Take some breath, do some deep breathing, finish your work. It's not necessary to just rush home because you need to finish it at that very minute. Because in long run, when you see, you might have a lot of time, but you might have a lot of pain in that time, and you wouldn't want that. So ease out your digital, all the digital athletes. I always say monitor height should be like billboard. So as you see, you should be able to see your monitor. It shouldn't be too up, it shouldn't be too down, or in either of the direction. Okay. And body, of course, is like your Instagram algorithm, right? Whatever you feed in is what you're going to get out. So it's very important that you drink enough water, you make enough movement, you be at calm, do some deep breathing. Every time you get angry, just go and do some push-ups. Whatever exercise that you love the most, keep it whenever your stress levels are extremely high. Use it that time. So your algorithm should be decided by you. So it's for your benefit. So when you go back home, you have to spend time with yourself. It's not what you're giving to the outside. You have to give some things to the inside as well, so that you also feel better. Because with a good body, with a good mind, you will be able to sustain your job even probably after retirement. But if you're not giving it enough, even you won't be able to reach your retirement in today's time. It's very difficult. Okay, so give your body good food and good exercise. It's very important. So on an average, a person is using keyboard so many times, keystrokes, as I mentioned, which will further lead to tiny tears in muscles and scarring. It's a fact. It's in a research paper. So you don't come to know the whole day you're typing. You're not counting how many times you're typing. So it's very important to make sure you slow down. Okay. Now, recognizing your posture related symptoms, I told this thing in the first slide itself that recognize the smallest of symptom that that you're having and address it. And always it can be solved with some exercise and with some movement. There can be some conditions which probably won't which would need more attention. But if you are able to take that symptoms really seriously and then incorporate it with any type of exercise, you can choose any form like yoga, like pilates, like running. Everybody's hobbies are different. Some people don't like doing exercise at all, which is absolutely okay. What you can do is come to the workplace, just take a few movements like lifting up your calf or doing some squats or moving your wrist, moving your elbows, moving your shoulder, moving your neck, and just moving your back. At least this will help you sustain your work longer. At least you're not causing harm to your back and low back, even if you're not exercising. Okay. So that small effort is most important effort that we are going to take. Now, why is this alarm sign alarming? It's alarming. Basically, it's telling you, okay, your neck is having some symptom, your back is having some symptom. Take some attention over it. If you take attention over it, I'm sure in long run you wouldn't have that much problem. So these are some of the techniques that is used in order to lift objects. So what happens generally is that there are many times that we see that many people are sitting for long hours and working. Okay, so your back is already at risk and back muscles are already spasm. And supposedly you're doing some moving in the house or some kind where you have to lift heavy weights, or probably you're going for a vacation and you have to move the trolley bags, right? So that's when you end up into a spasm. And I have had this complaint that people have gone for vacation, came back and had a very bad neck spasm and back spasm. Is because your technique of lifting has been incorrect. So whenever you're lifting, you have to make sure you do not arch your spine like this. Or you, because the whole load, as you see, is on your spine. If you just give a good squat, as you can see in this picture, the man is just trying to go down, give it a good squat, lifting up the object, and then extending his back and slowly tightening up his glutes and then taking it forward. Okay. These techniques are very important. You have many videos on YouTube as well that how to lift these objects, heavy objects. You should go and learn it because it's not easy. Some people will put their knee forward and some people will push their back too backwards. So over a period of time, you learn it. But the ideal way is, if you remember to how to squat is the best thing. Squat down, lift the object and then move forward. Do not always put these pressure. Even that one movement and once is enough to cause spasm to your back, which we don't want, right? So avoid, use comfortable handles to hold. Just don't be like, I'm going to be the hero. I'm going to lift everything by myself. No, calm down. Give yourself that time. Don't have to be the hero all the time. Okay. Uh, other ways can be sliding the objects. This is from our ancient times that people are using smart techniques to do their work. So don't have to always pull, push or something like that. You can always use a slider. You can make convenience for yourself. Because see, if you're exercising and if you're doing a good job, every single day you're disciplined, you're exercising, you're going to the gym, or probably even at home you're doing some exercises. Your body will support when you're lifting heavy objects. And when you know that it won't, then why take the risk? Just find an alternative. That's what I will tell you. Okay. Now, what are the biggest myths and facts that one comes across in terms of back pain, neck pain, and many other things regarding exercise? So, as I mentioned, that squatting. So many people think that, oh, I don't want to do this exercise. I don't think so I can do it, or it gives me backache whenever I'm doing it. It's not this. This is one of a very good exercises. Helps you pump really well with your whole body. Okay, but you have to make sure that your body posture is right. You see this woman kind of doing a good squat here. So her spine, as you see this line, it's almost straight, right? She has made a tabletop, like she's as if she's sitting on a chair. She's made. So the knees are not forward. The knees are right under the toes, which is a very important thing that you have to follow. The knee should be right under the toes. You maintain a 90, now you maintain a 90-degree angle, not at the chair that you're sitting, okay? Make a 90-degree angle, keep your back straight and do a squat. Now, why I'm giving you this exercise, you see, this is a dynamic movement of the same thing that you're doing while you're sitting on the chair, right? So if you're sitting on the chair all the time, you're in a static position, which means in those angles itself, the lymphatics have not worked, the fluid has not circulated. But when you dynamically create that activity, like when you're sitting on a chair and you just get up and then you sit and do some squats right near your chair, it is at least going to keep this flowing, the blood circulation flowing, it will pump. You don't have to do 100 reps. You just have to do 3 reps. Is 3 reps possible? Yes, it is possible, right? Throughout the day, before going for a coffee break, just do this 3 reps of squats and just walk. It will hardly take 30 seconds. Now comes lunges. Lunges is how you're walking every single day, right? It's just kind of mimicking those steps. Now, this is really very good for your knees. Many people think squatting is for your knee. No, squatting is basically for your hamstring. It's the longest muscle that is supporting you all day. So it will help in walking. Similarly, with this will help you with your glutes, with your knee, with your whole body posture. So you're kind of creating a balance from your head to your toe. So this is also one of the good exercises that help you align. Your balance will be, challenged initially, but then later you'll be fine. Okay. So these are the two exercises I want you to definitely incorporate in your everyday. 3 reps, that's it. Okay. Now, this I want to explain you what really happens to your pelvis when you're standing, when you're sitting. See, as you can see, I'm not going to go into deep into the scientific terms. You see how the pelvis is rotating anteriorly, posteriorly, forward, and this is how a neutral balance should be. Most of the clients, when they are standing for any kind of meeting, they go into this posture without even knowing they are in this posture. Okay, sometimes they are like this. Most of the women tend to develop this kind of posture because of the hip placement, how it is. Okay, so going back, when you're doing these exercises, you're kind of regulating this movement. So when your spine is having a good movement throughout the day, it won't cause these muscles, which is in the front, the quads, the hamstring, the core, all this to be weakened or stretched. Okay. So maintaining a good posture is important, but with exercises. Okay. Now, this is some of the corrective postures that I've given. But honestly, I don't agree with all of this all the time, especially this one, the sitting and the sleeping. See, you need to be comfortable. Sleep the way you want to, sit the way you want to, but add movement to it. You cannot be robots all day, walk like this man who is extremely straight, swinging right. No, the point is, yes, you have to maintain a right posture, but along with movement, you cannot put this posture into static. Oh, I'm maintaining the right posture throughout the day. I should not have any problem. No, you need to add movement and also maintain right postures. It should be dynamic. Now, this is what the doctor explains you. What has happened to you when you go with extreme symptoms and you take an MRI. See, as we are aging, it's obvious that our MRIs are going to look blurry. Does our photo look the same as I was 16 years old and how I am today? It's not going to be same. It's not going to be same even if I turn another 10 to 20 years older. Maybe there might be some wrinkles, there might be some changes in I won't look the same. Similarly, our body X-ray scan and MRI will not look the same. So there could be some accidental findings that you are suffering from a herniated disc and something like that, but maybe you don't have symptoms. So do not put it in your head and worry about it. Rather, there are a lot of muscles surrounding this area. You need to target on this first. You need to get it strengthened. So whenever you address there is a herniated disc or something that you come across in an hospital, okay, borrow some time if it is not an emergency. Try to address that you can strengthen these muscles first under the guidance of a physiotherapist. And then when you strengthen this, I'm sure that this disc can be improved. Since it's not torn out and it is not leaking out, it can still be treated conservatively. So it's very important. One need to have the awareness that these issues can also be treated with good. You imagine we had to read all of this. all of the muscles, origin, insertion, supply. Imagine how much we want to appreciate the muscles of the body that support us throughout the day. But at times we don't use it at all. But my guidance to you all would be try to use one muscle each day. One muscle. Okay. And now there are some exercises, and I'm sure that you would have learned these exercises even in your, PE classes when you guys were in your school. But we have to incorporate it. Okay. The first year, the girl is showing a lat stretch. It's very easy. You can easily push yourself on each side and stretch this. Okay. It will help. There is a large muscle here. Okay. That kind of supports the whole of us all the day. See here, this muscle. Okay, so all the time you're sitting on angles, when you stretch it, it is going to give a good stretch to that muscle. Second is your shoulder. Your posterior capsule is very important. Okay, so you hold and you just give a good stretch. Is this a difficult exercise? Can you not do it on everyday basis? Of course you can do it. It just takes like 2 minutes while you're talking to a friend who's sitting on the other desk. Just stretch yourself and ask them to stretch too. Stretch your triceps. Why triceps? Because all the time you're sitting in this, shortened position. So of course this muscle is going to be tight. So stretch it, stretch it. Okay. Then is this. This is one of the stretch that you can incorporate for your scapular base. So as you know that all the time, either you're sitting like this or you're sitting like this. So if you just grab both your fingers and push yourself forward, you will find a good stretch in between this, in this area. You will find a very good stretch here. You will feel the stretch. Okay. And you can always, she's using some kind of things to squeeze in the hand. You get these stress balls that are very good. It can help with the finger movements because you're constantly typing. If you just release some stress from your wrist, it will be really helpful for you. So yeah, you can do these technique as well. Then these are the some neck movement what I was talking about. There are some individuals who don't like exercising, so you can just keep doing and moving your neck on all angles. Don't overdo any movement. Don't be like, okay, today only I want to completely stretch my neck. No, grab, take a small stretch. That should be enough. Take a small stretch. Look downwards. Look on the other side. When you take this neck and pull down, you'll find a stretch hole from your neck area to your lower back area. You'll find a good stretch. And I like always testing my shoulders are in place. This wingspan, you can always, grab both your hands and touch both the fingers and see if you're able to touch it. So your shoulders are in good place and it is not like tightened up because of the posture that you have maintained the whole day, right? So these are very basic. I'm sure each one of you all can be able to do this. Also, you see this, yeah, the seventh exercise, it's the retraction. So you remember the first one I told where your neck is falling in the gravity. So always say, pull your neck back, pull your neck back. Okay, love yourself, love your neck, pull your neck back and just give a good retraction. See, it's a fun exercise. Just give a good retraction and you'll feel little calm at this area. Okay, so you should just have a set of like one routine set in your workplace that no matter what, no matter how much stress I'm going through the day, I'm for sure going to do this no matter what. It's very quick, very easy. It will help you circulate some oxygen to your brain. Even if you go brain fog, you will feel much better. You'll feel like, okay, I'm thinking better. So it's very important. Okay. So these techniques help to improve posture. I've already explained. See, incorporating these stretching techniques into daily routine can be significant enhance in your posture. You start looking yourself like, oh, I feel a little good. I feel my posture is good. But by God's grace, what I feel is my job doesn't require much of sitting. I'm always on my toes and I'm always running. So I used to always think that, oh my God, if I keep on running from one and the other, what will happen to my back? How will I treat patients? But I don't get same kind of patients all day. Some might be very difficult, like I have to use more pressure and things like that. But since I'm moving, I myself realized that movement is so beautiful. Like you just keep moving around. You don't feel that fatigue and the stress even when you have a very stressful life or a stressful, career. You feel that okay, my body is supporting. How is it supporting? It's because you're adding movement. You're giving what the body wants, basically. So, you make a system at home, right? You have a maid who's going to do the work for you, or maybe some people don't have. I'm just giving an example. You just create a system so that everything is happening functional. Your inner body also wants that system. You create a system every 2 hours, giving it water. Every half an hour, you're giving it some movement. You're giving it some break. That internal thing will keep going on and it will run fine. It won't trouble you later. But the minute it start troubling you, you start getting panicked. So create a system within which is automized, and you'll be fine. You won't have to think much throughout the day. If I've worked out, if I've done just little bit, very little. It Nothing is better than something. Give it something. Okay. Now, this is from a research article where it has been proposed intervention that in an office or an ergonomic environment, these are the things that are very important and should be there. So I'm sure that most of the things are already present here. So I'm just attaching this. Maybe once I share it later, you all can look into it. What are the things that probably you need, and if it is already there, and most of the things are already present, so you don't have to even think about it. So these are the ergonomic things that a company is taking for the benefits of the people. So I also want the people should be taking the benefits for themselves as well as an individual, right? And there is a checklist that has been given. It's a very general factor checklist which you can keep at your desk, and how many repeated movements that one undergoes throughout the day. What are the technique that is used at workplace, because some workplace have physical work. Like for us, we have physical work. So what kind of physical work is required? Is there a trunk twist, bend? How many hours, how many times we are supposed to do? This is just a general checklist one can keep. You can read about it and you can keep handy. So maybe you see your improvement levels, how much you have improved, how much pain and aches you have overcome throughout the process. Okay. So as we are moving to the world of AI, there are going to be a lot of technologies that are going to be used in order to, mark our postures, how our posture is, and if one is doing the right, I'm sure there are going to be AI chairs as well, which is going to keep prompting you that, oh, you're not sitting right, or you're sitting right, or something like that. I'm sure. So, but this is a very good AI system module that they are working on. Is that in factories there are a large group of people. You cannot keep an eye on one each person. So their techniques will be monitored on day-to-day basis in order to avoid any kind of hazards, ergonomic hazards in their everyday life. So they're going to have these systems where they ask each one of them to come and show the techniques that they're using in order to place the boxes and things like that. So they will also have a data which will help them to know that how many individuals are going on longer leaves, how many people are getting injured. So if their body posture and everything is maintained well, I'm sure that they can not be affected by these kind of work at workplace. Okay. So what have we learned today? uh, Not sure if the back problem is because of bad posture or the bad posture is because of back problem. So we don't know which one has come first, isn't it? But I would suggest all of you guys that, always the back ache and the neck ache first starts with the bad posture, or the work, something that we have not done right with our body. So we have to just self align. So I'll just summarize what are the things you should be doing on your everyday lifestyle. So the first, many of the queries that I have, that how many times I should do this exercise and how many times I should sit in a stretch. So you can sit in a position for as long as 30 minutes. After every 30 minutes, ideally 20 minutes, but 30 minutes, you can take a break, drink some water and do some stretches. Throughout the day, you can at least do 3 squats, 3 lunges, do some stretch. If individuals are having knee pain or back pain and cannot do, squats or lunges, they can use chair. They can just get up and sit on their chair. Just weight bear on your knee, squeeze your glutes, and sit back on the chair, and they can do some wrist movements, they can do some stretches, they can do some neck movements, and avoiding continuous typing, your wrist, taking care of your wrist, moving enough. You can keep a soft pad under your desk so that you're not compressing directly onto a hard surface all the time. And yeah, you need to incorporate as much as movement as you can. Even if you walk around, it's all good. Okay. So please put down your questions in the Q&A box, and I will answer to them. If you all have any kind of doubts, please be free to ask. Any questions? You can type it out.
Hi, Dr. Joshita. Thank you so much
Hello,
for the presentation.
my pleasure.
We do you can stop sharing your screen because uh,
Okay, yeah,
that
sure.
way we'll get to see you
Yeah,
while we are discussing questions.
yeah. Can you
Um,
see me?
so we do have a couple of questions in the chat box. I would again request all of you to put in your questions in the Q&A tab, so it'll be easier for us to have all the questions in one place. Meanwhile, I will read out the questions that we have in chat box.
Yeah.
Are ergonomic chairs, keyboards, or mouse pads worth an investment?
See, so if you are developing any kind of everyday difficulty, which is like, you're not able to work efficiently, you're having some compression, or you feel that your wrist is not supporting, then yes, you can invest in these chairs, keyboard trays, mouse pad. It is as per your convenience. See, um, whenever we advise our patients that they ask for these belts, the lumbar belts and everything. Whenever they wear that lumbar belt, it's not efficient, it's not a good idea. You know why? Because their own muscles are not working, because your muscles kind of become like inefficient, and they're just dependent on the lumbar belt that they're wearing. Similarly, in this case, what happens is you'll become very dependent. You'll become dependent on these kinds of ergonomical things. You'll not move because you've made everything very convenient. Chair is a very good investment. And about the keyboard, it is clearly self, like it's not going to add benefit. Unless and until you reduce the typing, you're not going to do any good to yourself, right? Because even if you get a good keyboard and you're still typing continuously, you're still doing a repetitive movement. So any repetitive movement will lead you to these pain. It won't matter if you're changing these things. But if you're changing these things and it is giving you comfort, and then you're adding movement to it, then it's perfect.
Thank you so much
Hope
for
I've
answering
answered
that.
your question.
Yeah, that was pretty clear. The next one, person would like to know, is there any particular exercise that you can recommend for spondylitis?
Yes, so spondylitis is a very vast condition, okay? So I can't directly address it like that because I would need to know how it came and when the spondylitis occurred, what's the stage of the spondylitis based on that. But however, you need to start getting into a strengthening program. And the one exercise that I had mentioned about chin tucks, to begin with, this is good, but you need to start strengthening your scapula blades, which will require some bands, and you can definitely go ahead and take a session, elaborated session, where I can teach you a few exercises of your back, of your scapula blades, because spondylitis won't go with one exercise, right? You have to offload the joint, and in order to offload the joint, you need to use the other muscles for it, right? So but the neck movements that I suggested and the chin tucks can be okay to start off with. Okay, because I don't want to add on a very heavy exercise for you, which might increase your pain. Since I have not assessed you, I cannot directly give you an exercise. Okay,
Thank you, doctor. The
my
next
pleasure.
person, one second. Yeah, the next person would like to know, he got a knee pain. What would be the ready exercise to do for knees?
Okay. So first thing is, how did the knee pain come? If the knee pain has occurred because of an injury that you were running and you fell, and because of which the injury has happened, then you definitely first need to take an X-ray, meet a doctor, and understand if everything is okay inside your knee. Okay. The second thing is, if you just had this wear and tear because of long walking or something and it's come, just like that, so it could be that you have increased the capacity of your daily work. Maybe you're walking too much, running too much, or any activity that you're doing too much. So first thing you can do is you can start icing your knee. It's safe so that you get your pain in a bit of control. Second thing is you can start doing knee extension exercise, which is simply sitting and extending your knee at this straight angle and then bending it straight and holding it for 10 seconds and seeing if the pain is not aggravating, you can continue to do that. However, again, this is not the only exercises. There could be times that you must have, overused a muscle or a tendon which needs to be released, and then you might feel a better. See, gauge your pain. If your pain is anywhere between 10 to 20%, do some icing, do some leg extension exercises, and then slowly progress to the squats that I told you. But if it is more than 7 out of 10, okay, if 70% of pain is present, then I would suggest you to please seek help. Okay. Yes.
Thank you. Would you have any advice for commuters who travel daily between, like for long distance, say for example, between Sharjah and Dubai, and they are spending
Yes.
3 to 4 hours in traffic?
Yes, exactly. That's a very a good question. So I would suggest you see, first thing, you know that you are going to travel for so long, right? You need to prepare your body in the morning only. You have to do some exercise, some movement, some at your back exercises for sure. Now, before getting into this, car or however you are traveling, do some pelvic tilts. Just do some pelvic rotations like this so that you're easing the pressure. So it's basically anterior, posterior, anterior, posterior. Remember the slide that I've shared? So you're basically moving your hip anteriorly and posteriorly. So you move, okay? Then you need to do some calf raises. Calf raises. So this calf raises can be done even in sitting position. You just lift your calf and drop. Lift your calf and drop. Now what is happening is calf is your second heart of the body. It pumps good amount of blood continuously. So when you have given enough pump to your calf, for that 2 to 3 hours, it's going to circulate in your body and you're going to feel better. Okay, and also you have moved your ankle. So when you're sitting for this 2 to 3 hours, you won't have that much trouble. How much you need to do? At least 30 repetitions. 30 repetitions before you sit in the car. Do some pelvic movement and do this calf raises. I'm sure you won't have that cramping or any kind of problem because you have given good supply to your body. It will help. And of course, when you get back home, stretch, do some activities so that, even if the lumbar or the neck has gone through the stress for 3 hours, when you go back home and do some movement to it and some stretches to it, it will not hurt. The staticness, the force on it will reduce slowly. Yes. Hope I've
Thank
answered
you.
your question.
Thank you so much, doctor. Could you show
Yeah.
some exercises for lower back pain as well as L3 and L4?
Okay, so see, there is no particular exercise for L3, L4. It comes as a whole lumbar unit. Okay, so one of the exercise that you can do is you can just roll up a towel. Okay, roll up a towel, and in this space of your back. Okay, since the whole day we are anterior, like we are always like present anteriorly, you can push your back against the chair or against the bed and then release it. Again, push your back. You basically are clearing the arch. So you see this spine, it is like this, like it is curved, right? So the whole time when it's curved, it is putting a lot of pressure on this disc. You're basically trying to clear the arch. So whenever you're pressing it, pushing your back, I don't know if you can see, you need to push your back to the couch and just hold it, and you'll feel a good contraction on your abdomen when you're doing it. So you push, you hold, and then release. You push, you hold, and then you release. Okay, so this will clear your arch. So the pain that you're getting in your lumbar will be taken care of. And the second most important for your back is squeezing the glutes. Glutes is the largest muscle. So if you use your glutes for your benefit, squeeze your glutes and release your glutes. It can be done even in standing, it can be done even in sitting. Just have to tighten up your glutes and then release your glutes. Tighten up your glutes and release your glutes. Also, that's why I have given a very functional exercise to do is squats. Squats will also help with your back. Okay, because it engages your glutes and your hamstring, so it stabilizes your spine indirectly. Okay.
Thanks a lot, doctor, for answering that. Would you recommend any, what are the points that we need to keep in mind while we are buying an ergonomically friendly chair for work? Like, are there
Uh,
any?
yeah. For when you're buying an ergonomic friendly chair, you have to make sure that first thing it is adjustable based on the height of an individual because your legs should not be dangling in the air. The leg should always be with the support of the floor because if it is dangling, one might develop swelling in the leg. It's the most important thing. Then, as you see, it can be a rotational chair. Why rotation is important is because if the way you're when you're rotating your chair, you're also rotating your spine, which gives a freedom of movement at your spine and at your neck. So any chair, it has to have some freedom of movement. Okay. Now, whenever you're marking your chair, your hand rest, your arm rest basically. So your arm rest should all be at 90-degree angle. So everything will be at 90-degree angle. Your spine and your hip, your knee and the floor, the hand rest all at 90-degree angle. So ideally, something that is adjustable based on an individual's height should be ideal. And at the back, there should be some curve that is supporting their back. That is an ideal chair. So if there is completely like a flat and there is no back rest, a person cannot rest his back or move backwards like this, then I think that ergonomic chair won't be really helpful. So from all angles, it should be movement. So as you see here, I can move back, I can rotate, I can adjust up and down. That's an ideal chair. That should be enough.
Thanks
Any
a
other
lot,
question?
doctor. Yes, we have lots
My
coming
pleasure.
in. A lot of members have also requested for the presentation as well as the recording.
Okay.
Please, may I request you to reach out to your HRs and we'll be happy to share it with them.
Sure, 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 sure. Definitely.
To what extent can chiropractic treatment help in relieving back pain or lower body pain, doctor?
Okay,
It's
so
a very
see,
I mean, even I have this question in mind, like how effective is chiropractic treatment? A lot of
uh,
people are quite scared of doing a chiropractic treatment.
yes, definitely it is a very challenging technique to be used. See, so what does chiropractitioners do? As you see, this is your spine, right? And this is the bone that is present around. So whenever you're sitting for a long period of time and everything, so your muscles that you have not exercised or something, they become stiff. Now, when they become stiff, they are pulling the spine downwards like this. So there is a lot of crowding of the spine that happens. Now, if you see closely, there is this opening on both the sides. When this opening comes and sits on this opening, after the stiffened muscle, they come and sit here. Your joints kind of become locked, interlocked with each other. So when the chiropractitioner are kind of manipulating, it kind of helps you just correct the order. Now the thing is that some people just have it. Their spine are like this. It's just like that because they are probably not exercising or they have never exercised. So every time they are in a static position, there is crowding of this spine, and then every time you crack it, you get that noise. So that noise is very addictive. So mainly people go for that noise. What exactly happened? It just releases the fluid there. Like it's an empty space, a bag of fluid, and just pops. Or maybe because there is some rotation, it pops. Now whether it is good or not. Now this is very debatable. uh, anything that is happening directly to the spine area, that is your bone and there is your disc and these kind of area, it is risky first. Second, again and again doing this correction can cause wear and tear directly to your bone. So if your bones are brittle, if your bones are not able to support it, there can be chances that over a period of time you might develop osteoarthritis and osteoporosis. These kind of osteoporosis is a more hormonal, but you might hurt your bone and make it really weak because you're continuously putting some load and cracking on it. Okay, so when is it advisable? See, somebody is genuinely locked in a locked situation where the person is unable to even move. In those times, cryo practitioners really help to align your spine. Okay, apart from that, if it is just to, like, my back is hurting a lot and I want to go and crack my back, no, it won't help. The only thing that will help is exercises, because the pain that you're feeling is firstly giving, the signals are coming from the brain that is supplying, the muscle is actually telling the brain, see, I'm having pain, so please do something about it. The signals itself is sent by the muscles. Then if you don't repair that, then of course the pain is constantly going to be there, if you understand what I'm saying. So if somebody is really in a locked position, to unlock those things, yes, they help. But apart from that, no, it can also be a risk factor.
Thanks a
Hope I've
lot,
answered your
doctor.
question.
Thank you so much. I know
Yeah,
we've gone little over the time, but
it's
I'll take
okay.
this last question and then we can wrap the session.
Yeah,
The
yeah.
person would like to know, is there any cure or permanent solution for disc bulge? Or is there any permanent exercise which can be helpful for affected people?
See, there is a permanent solution, definitely. But there is no permanent exercise. Okay. You have to exercise on daily basis to a stage where your back is now able, your muscles are able to offload that disc. So basically, the disc, herniated disc has been come out, and if it is not torn out, see, when the fluid is leaked out, then you have no other option. The pain is extremely a lot. You won't be able to walk. There will be extreme symptoms. So, of course, the only option would be surgery. The next before that, when it is not out and it is still in place, the all the, maybe it is mildly out, but it is not torn out and it's not leaking out. In that situation, you have to rehabilitate all the muscles that are present at the back area. Now, the rehabilitation is a long process. It's a 3 months process. It's not one exercise. It's a lot of exercise where you make, so we call as movement integration. You first exercise the muscles and then you add the movement integration in such order that in every position that we put the patient, they won't develop that disc pain. Okay, so it's almost a rehabilitation of 3 months. And once the individual has rehabilitated, it is also mandatory that even after that, he has to do some basic 5 to 6 exercise that his physio will advise him to do. Not every day, but at least twice a week. And then I think he will do fine. That's the ideal way to treat it conservatively. But however, if the patient just takes the exercise, go back, it can be a recurrent episode. And these recurrent episodes are not good because it leads to chronicity and then further may lead to that complete tear and the disc might be out. So the only permanent solution would be that you undergo a good rehabilitation for 3 months and then give that 5 exercise that every day to making sure that your muscles are active. And I think then after that, you can carry on with a normal life. Like even gym, lifting weights, everything will be sorted. Hope I've answered your
Thank you.
question.
Thanks a lot, doctor, for answering all the questions.
Yeah,
And with that, we've come to the end of the session. I
yeah,
really, really personally enjoyed the session. It was so informative. It
I'm
wasn't
glad.
too technical as well, and it genuinely helped us understand, what minor changes we can make in our everyday life and routine to see bigger health. changes, health
Yes,
related
yes.
changes.
I'm glad. I'm glad I could help. And I would really, really feel really good if you guys really incorporated it in everyday life. See, the earlier question somebody asked me about the low back, that is, there is a permanent cure. Muscles are just like any objects in our house. They are going to get fatigued, and I mean, they need maintenance. They have to be addressed on everyday basis. They cannot be like preserved in the locker, like, okay, today I have exercise in the gym and this will be preserved thereafter. No, you need to do it every single day or at least once a week to make it active and long running for you, because it's a part of you. It needs attention every single day. Okay. And it was really nice giving you all this session, and hope you all stay healthy.
Thank you, doctor. I hope you have a great day ahead. And for
Yeah.
all of you, thanks a lot for joining us. And we look forward to seeing you for our upcoming sessions.
Okay, see you. Bye bye. Bye
Thank you.
everybody. My pleasure to all. My pleasure. Bye.